once you get addicted to something like opiates, it has so much power over you and has so much control over your life that you literally, like, you can't function or do anything without it. After many attempts over the last couple of years to try to get clean, being in jail, honestly, to me, was exactly what I needed to get the shove into, recovery.
His name is Dallas. His personal story of addiction, crime, and incarceration would sound familiar to those who work in the criminal justice system. But his story of recovery is unusual, and it provides enormous hope for people battling opioid use disorder in jail and those who supervise them.
The jails are the place to find the people with the most serious addiction who are the most at risk for not only death from overdose, but also for committing more crimes. And so between those two, it's the perfect nexus for treating.
It's called MAT, Medication-Assisted Treatment, an evidence-based recovery component that supplements group and individual substance abuse counseling with several FDA-approved drugs, scientifically proven to eliminate the symptoms of opioid withdrawal and cravings. These include methadone, buprenorphine, also known by its brand name Suboxone, and naltrexone, also known as Vivitrol. Dallas received Suboxone.
By the time that they had got me on the Suboxone, it was such a relief just to be able to think normal again. You definitely feel like at some point you can catch your breath, and you're not, at least like at that point, the cravings, your mind, it's not like all you can think about. Going through the withdrawals, I didn't want to do anything but just lay in my bed. After I got the Suboxone, I ended up getting into the worker tank. The guards noticed that I was getting up every morning and cleaning and just showing initiative. And I wasn't doing it for any reason other than the fact that I just felt better.
MAT is a huge departure from the forced withdrawal model that still permeates most of the criminal justice system, at great peril to people behind bars like Renee, who says cold turkey almost killed her.
It hits you deep in your bones, and it hits you deep in your mind, and it's suicidal thoughts, and it's not sleeping for a month. There was a very strict view of what heroin addicts were like, and you did it, so you suffer for it, and this is part of your punishment. The lack of compassion and the bias still exists in the system for drug addicts in particular, especially heroin addicts.
We in the criminal justice community are used to seeing folks with addictions and with opioid addiction through a certain lens. And now we're shifting that lens, and that transition involves a lot of work, a lot of outreach, a lot of education. We can't arrest our way out of this problem.
Nobody wants to see anyone suffer when they come into custody.
Santa Rita Jail in Alameda County is an early MAT adopter, one of many California correctional facilities embracing the research and adapting protocols to bring MAT to detainees who need it.
Santa Rita Jail is kind of unique in that we've been dispensing methadone since the 90s. So when the opioid epidemic increased in this area and started to hit us, we didn't have to adjust too much with the care that we provided in the jail. Up until a few months ago, we would maintain methadone for pregnant females, and everybody else would be on a methadone tapering program. As of June 2019, our medical contract provider switched to methadone maintenance for anybody receiving MAT when they come into custody, which is in line with current medical best practices.
2 months later, jail policy expanded MAT beyond methadone to include Suboxone and Vivitrol, along with counseling services. Supervisors say the program is working well and that the benefits far outweigh any challenges, including the risk of inmates diverting MAT medications.
If people aren't dosing or we think they're diverting, there are ways that you can address that. But I would rather try and provide it to people that need it than just say, oh, it's not worth the trouble, or it scares me. Because I can tell you, without MAT moving forward, we'd have people going to the hospital all the time. We would increase our liability as an agency, and we wouldn't be serving some of the biggest needs of the people that come into our custody.
When was the last time you used that?
Yesterday.
Yesterday? All right.
In some ways, it's kind of counterintuitive. You're going to fight a drug with a drug. It's kind of like fighting fire with fire. It's not a silver bullet in and of itself. It's part of a treatment regimen.
While Santa Rita builds its MAT pilot on the foundation of its methadone program, the Santa Barbara Sheriff's Office tied its implementation to a long-standing philosophy of rehabilitation, expressed through its Sheriff's Treatment Program.
And we've tried to identify people who are addicted to substances. Recently, We have augmented that with the MAT, medication-assisted treatment, and it's really a great blend. People who are in custody and are in an environment where we have a captive audience, we can actually sometimes reach out to them and say, hey, if you want to turn your life around, if you want to change, we can help you. We can give you some tools that can help you to do that.
We've made a commitment to medication-assisted treatment and are moving forward with it. If you were to walk into a doctor's office in the community and be offered one of these medications, the inmates that come into our facility are entitled to that level of care. We have to be part of the solution. If we're not, we're part of the problem.
As part of the protocol, the medical team collects data, uncovering promising results related to inmates receiving naltrexone.
These are folks who have been repeat offenders historically, and we're not seeing them come back into custody. That tells us we did something different and it's working.
600 miles away in the rural city of Wairika, law enforcement grapples with a large transient population and the movement of opioids along Interstate 5. County officials are using MAT to fight back.
The potential advantages of launching MAT in a small rural county is, again, we all know each other. I think because we have those tight relationships, it's made it easier to implement the MAT services in the jail.
The county's only methadone clinic is 2 hours away, so staff at Siskiyou County Jail have launched MAT using buprenorphine, which requires the medical providers to obtain a special waiver from the DEA.
The X waiver was not complicated at all. You learn about the drug, the effects of it, how to prescribe it, in what situations to use it.
The training was easy. The trust in the program is coming along.
I was very skeptical because I thought to myself, this is going to be another way for drugs to be perverted and not what they were intended for. The idea that has brought me around to being more of an advocate to this is the fact that we have to do something. So if we can keep somebody else alive and make a difference in one person, why not try?
Some of the clientele that comes in to the jail doesn't know about MAT, and nobody's really taken the time to educate them about that. So being able to provide that education and initiate that treatment process for them and giving them that warm handoff post-release, that's what I hope for.
And that's what they achieved for Dallas, a warm handoff to Siskiyou County Probation.
Within the very first day I got out of jail, I literally walked from jail, I walked over to the pharmacy, and then I walked straight over to the probation office. Those were the first two things that I did. I'm still taking the Suboxone. I currently am getting services at behavioral health. I'm in an intensive outpatient program there.
In order for MAT treatment to work, all the different facets of the criminal justice system need to be on board because there's so much movement throughout the system from the time of arrest till you are back in the community. Everybody really needs to be a part of supporting that treatment.
LA County Probation is on board. It's the largest probation department in the country, with 30,000 probationers, nearly a third of whom require court-ordered drug testing.
When we receive probationers who have issues with opioids, we're receiving them within 24 hours of release from custody. Their tolerance level for using opioids is really low. What they want to do is to get that next fix, right? This is a very dangerous situation where they could overdose. What we need to do is we need to identify the people while they're in custody, and we need to provide them with support. MATs not only assist the defendant with therapy, with treatment, with medication to get off opioids, but it also provides additional support to the probation officer to know that this person is actually working on getting better, working on recovery, working on rehabilitation.
We were just given referrals and, hoping our clients followed up with that referral. Now, using MAT, we're doing a lot more of collaborative work, I would say. We're working with providers that are providing services that are actually helping our clients.
Everybody needs education. The field is a scientific field, and evidence-based practice changes over time. And we owe it to our deputies and to our mental and medical provider to give them the information about best practices so that they're up to date, because they have people's lives in their hands every day, and they do a great job every day. we can always do better.
Probably the best reason for treating addiction in the criminal justice system is that you have the opportunity to succeed in 3 ways. You get them their lives back, you prevent overdose deaths, and you reduce crime because the person doesn't need the drugs anymore. It is the right place to treat people.
We each have a part to play for society to work. And as of my 43 years in life, I haven't played my part. I haven't contributed in the workforce. I haven't, as of now, I've been a drain. You know what I mean? I cost taxpayers money. I'm on Medi-Cal. And that makes me feel like, guilty and bad. I want to do those things. I want to contribute. I want to feel normal. MAT and therapy for me helps me live a normal life.
When I think about my future, I feel positive. Once I had reached a point of what I call no return with opiates, I didn't think that there was going to be any recovering from it. I know that I wouldn't have been able to get to the point I'm at right now without the MAT treatment. I literally feel like I've got another chance to be able to live my life.